Hi everyone, my name is Lakendria. So I have a patient that I'm gonna discharge today. So hello there. First off, congratulations on the arrival of your beautiful baby. As you prepare to head home, I want to take a few minutes to talk with you about your condition, about a condition called postpartum hemorrhage, which is essentially heavy bleeding after giving birth. Learning how to recognize warning signs now will ensure that you know exactly what to do when you reach out for help, should you ever need it. What is postpartum hemorrhage? Think of postpartum hemorrhage as losing a larger amount of blood than is typical after giving birth. While it's completely normal to have some bleeding after delivery, we become concerned if the flow becomes very heavy, similar to suddenly steady stream that doesn't seem to slow down. The common cause of postpartum hemorrhage is the most frequent reason that this happens is muscles of your uterus, which work so hard during labor, are having trouble staying firm. Normally, the muscles tighten up after the baby is delivered to naturally pinch off the blood vessels when the placenta was attached. If the uterus stays a bit soft or relaxed instead of firm, those vessels can continue to bleed more than they should. Risk factors. You might be at a slightly higher risk for this if you have had a very long labor, if your uterus was stretched more than usual, if you have given birth several times before, or if you needed specific medications like magnesium sulfate during your delivery. Certain conditions during pregnancy, such as issues with the placenta, can also play a role. Signs and symptoms. The biggest thing to watch for is bleeding that is much heavier than a typical period. Specifically, please contact us if you notice that you're soaking through a full sanitary pad in an hour or less. You should also watch out for passing blood clots that are larger than a golf ball. Additionally, you should also watch out for Additionally, keep an eye out for signs that you have lost too much blood, such as feeling dizzy, lightheaded, weak, having a racing heart, or noticing your skin feels cold, clammy, or looks paler than usual. Potential complications. If this heavy bleeding continues without treatment, your body can lose blood too quickly, which can make you feel extremely faint, lead to severe tiredness from anemia, or cause your blood pressure to drop dangerously low. The good news is that if we catch these signs early, we can treat it effectively and help you recover quickly. When to seek care. Please call your healthcare provider right away if your bleeding seems heavier than expected. If you develop a fever, notice a foul smelling discharge, or if your pain level increases significantly, most importantly, call 911 and head to the nearest emergency room department immediately if you are soaking through a pad in an hour or less, or feel like you are going to pass out, experience chest pain, having trouble catching your breath, or feel suddenly and extremely weak. Teach back. To make sure I haven't missed anything, could you tell me in your own words what signs you should look for at home, and when would you know it's time to call for emergency help? Thank you.